What if the very pill you take to sleep better or to calm your bladder is quietly destroying your brain? You're doing everything right. You take your medicine as prescribed. But lately, the memory lapses are getting worse. You walk into a room and forget why. You lose track of conversations. And deep down, you feel scared. Not just confused, truly scared of what's happening to your mind. But what if the real culprit isn't aging or even dementia itself, but a drug that's been silently interfering with your brain's chemistry? In this video, we're going to uncover the hidden danger behind a common group of medications called anticholinergics. These drugs are found in pills for allergies, insomnia, bladder issues, and even anxiety or depression. Backed by strong scientific research, you'll discover which medications increase your risk of dementia by up to 50%, how they impact brain function, and, most importantly, what safer, smarter options you can consider. If you or someone you love is worried about memory loss, this is the kind of truth you need. Straightforward, science-based, and easy to understand. And that's exactly what this channel is all about. Now let's dive in and reveal the pill that could be silently sabotaging your memory every single day. What are anticholinergic drugs? Let's take a breath and break it down simply. Not all pills are bad, but some work by blocking something your brain truly needs. You see, your brain runs on signals, and one of the most important ones is acetylcholine. Think of it as the spark plug for your memory and learning system. It's what helps you focus on a conversation, remember a name, or even just find your keys in the morning. Without it, your brain's communication system slows down, just like a phone trying to run without battery. Now here's where the danger comes in. Anticholinergic drugs are a class of medications that block acetylcholine. They do this on purpose to help with symptoms like overactive bladder, insomnia, motion sickness, or allergies. But the price you pay is steep: long-term memory damage. Here's the shocking part. These aren't rare experimental drugs. You probably have one of these in your home right now. Let's look at just a few common ones. Benadryl for allergies. Tylenol PM or Unisom for sleep. Hydrozygazine Vistaril Atarax for anxiety. Ditro or Ditropan for bladder control. Bentyl for IBS. Scopolamine patches for motion sickness. They may seem harmless, some are even sold over the counter without a prescription, but multiple studies, including research from JAMA and the University of Washington, show that using these drugs daily for as little as 12 months can raise your risk of dementia by 30 to 50%. Imagine that. Taking a pill for sleep or seasonal allergies, and unknowingly sacrificing your memory in return. You didn't sign up for that. And if you're caring for a parent or loved one who's already showing signs of forgetfulness, this could be the missing piece no doctor ever mentioned. You're not crazy for noticing the changes. You're not overreacting. You're right to question. And now that we've identified the danger, let's talk about what you can do about it, safer alternatives, smarter strategies, and how to protect your brain starting today. Evidence linking anticholinergics to dementia. Let's dig a little deeper, because what we're about to share isn't based on opinion or internet rumors. It's backed by hard science, and sadly, it's been ignored for far too long. The reason anticholinergic drugs are so dangerous is that they don't just block brain chemicals temporarily. They change your brain. Not just how it works, but how it's built. Here's the truth most people never hear from their doctors. A massive systematic review involving over 1.5 million people found that taking anticholinergic drugs, especially on a regular basis, is an independent risk factor for both Alzheimer's and all-cause dementia. That means these medications increase your risk even if you have no family history or other health problems. And the longer you use them, the greater the danger. Another review of 21 different studies revealed that using anticholinergics for just 3 months or more raises your risk of dementia by 46% compared to people who don't use them at all. Think about that. 3 months of daily use could push your brain toward long-term damage. And it doesn't stop there. A landmark study published in JAMA Neurology used brain scans to look inside the minds of people taking these drugs. What they found was heartbreaking. Visible shrinkage of brain structures and reduced brain metabolism, the kind of changes you'd expect to see in someone with early Alzheimer's. This isn't just about brain fog or feeling sleepy. These drugs may be reshaping your brain quietly and permanently. And yet, many people, maybe even you or someone you love, are taking these pills daily without any warning label or real explanation. It's frustrating, it's frightening, and most of all, it's preventable. Now that you understand the science and the real impact on your brain, the next question is simple but urgent. What can you do instead? What safe alternatives exist that won't put your memory and independence at risk? Let's talk about the smarter choices that protect, not harm, your brain. How anticholinergics harm the brain. Let's make this crystal clear, because understanding how these pills hurt the brain is key to protecting it. Your brain relies on a chemical messenger called acetylcholine. Think of it as the Wi-Fi that connects your thoughts, memories, and decisions. It sends signals to areas like the hippocampus and cerebral cortex, the parts of your brain that control memory, learning, and awareness. Now imagine turning off that Wi-Fi. That's what anticholinergic drugs do. They block acetylcholine from binding to its receptors, especially the muscarinic receptors that live deep in your memory centers. Yes, these pills may calm nausea, reduce gut spasms, or stop an overactive bladder, but they do it by disrupting communication inside your brain. In the short term, that means confusion, brain fog, and slower thinking. You might brush it off as stress or aging, but it's not. Over time, especially in older adults who already have lower acetylcholine levels, these drugs can lead to permanent brain damage, actual shrinkage of brain tissue. And the worst part? The effect builds up when you take more than one of these drugs at once. For example, hydroxyzine for anxiety, Benadryl for allergies or sleep, ditropin for bladder issues. Separately, they're harmful. Together, they can shut down major systems in your brain and nervous system. Quietly, gradually, and without warning. It's no wonder patients start feeling like they're not themselves. It's not just age. It's a chemical disconnection happening inside the brain. But the good news? Once you understand what's happening, you can take back control. You can reduce your risk, support your memory, and explore safe, proven alternatives that don't come with this hidden cost. So now, let's look at what those smarter options actually are, and how you can make the switch gently, without feeling lost or overwhelmed. If you're enjoying this video so far, don't forget to hit that subscribe button so you won't miss any future tips on managing blood sugar naturally. And if you have any questions or something you're struggling with, drop a comment below. I read every one and I'm here to help. Who's at risk? Let's pause for a second and ask a simple but powerful question. Who is most at risk? Because knowing the danger is one thing, but knowing if it applies to you or someone you love, that's where true prevention begins. The truth is, not everyone reacts the same way to anticholinergic drugs, but certain groups of people are especially vulnerable, and sadly, they're often the ones who need help the most. First, if you're over the age of 60, your natural acetylcholine levels are already lower. That's just part of aging. Your brain is more sensitive to chemical interference, and what might seem like a normal dose for a younger person could be toxic to your memory. Second, if you or a loved one is already showing signs of forgetfulness, like misplacing things, struggling to find words, or repeating questions, then these drugs can speed up the process dramatically. What might have been mild forgetfulness can turn into full-blown cognitive decline if anticholinergics are involved. Third, the danger multiplies when you're taking more than one of these medications at the same time. It's called the anticholinergic burden, and it's not rare. Many seniors unknowingly combine sleep aids, bladder meds, and allergy pills, thinking they're helping different problems, when in fact, they're adding fuel to the same fire. Even short-term use can cause symptoms like dizziness and confusion, but long-term daily use, over the course of months or years, has been clearly linked to permanent memory loss, higher dementia risk, and even structural brain shrinkage. And here's the part that hits hard. Most people have no idea this is happening. They trust their prescriptions, they follow the label. They never connect the pill to the memory problem until it's too late. But now you know. And that knowledge gives you power. Power to act, to protect, and to make better choices moving forward. So what are those better choices? Let's look at the safe, brain-friendly alternatives that science supports so you can treat your symptoms without harming your mind. Safer alternatives and precautions. So, what can you do, starting today, to protect your brain and still take care of your health? Let's shift gears now, because this part is not about fear, it's about hope. The truth is, some people do need anticholinergic drugs in emergencies, like using Benadryl for a sudden allergic reaction. That's understandable. The real danger lies in chronic use, taking these pills every day for weeks, months, or even years. So here's your first step. Check your medicine cabinet. Go through both prescription and over-the-counter medications. Write down the names and talk to your doctor or pharmacist. Ask directly, does this medication have anticholinergic effects? And here's the key, never stop a medication on your own. You need your doctor's help to safely switch to better options. So what are those brain-friendly alternatives? For sleep, instead of Tylenol PM or Unisom, consider gentle supplements like melatonin, ashwagandha, chamomile tea, or magnesium glycinate. If you need a prescription option, trazodone is often used and has minimal anticholinergic activity. For allergies, instead of Benadryl, look for second-generation antihistamines like Zyrtec, Claritin, or Allegra. These don't cross the blood-brain barrier as much and are safer for long-term use. For bladder control, talk to your doctor about mirabegron, a modern medication that doesn't block acetylcholine. For IBS, try peppermint oil, especially enteric-coated capsules, or ask your doctor about alternatives depending on whether your main issue is constipation or diarrhea. But medication isn't the only factor. You can also protect your brain by taking care of your whole body. That means getting enough sleep, moving your body daily, even if it's just walking, managing blood sugar, blood pressure, and heart health, reducing stress, and staying socially connected. All of these habits help your brain produce and protect acetylcholine naturally, and even reduce your risk of memory loss over time. You're not powerless, you're not too late. You can take small steps that make a big difference. And now that you know the risks and the alternatives, let's bring everything together with a final message of clarity, action, and encouragement. So here's what we've learned together today. Some of the most common pills taken for allergies, sleep, anxiety, or bladder issues may quietly raise your dementia risk by up to 50%, especially when used long-term. These medications, known as anticholinergics, block acetylcholine, one of the most important chemicals your brain needs to remember, to think, and to stay sharp. This isn't just theory, it's backed by real science. From brain scans showing atrophy to large-scale studies confirming memory loss, the danger is real, but so is the hope. By reviewing your medications, talking openly with your doctor, and choosing safer alternatives, you can take control. And by sleeping better, eating well, staying active, and caring for your heart and blood sugar, you're also caring for your brain. If this video helped you, imagine who else might need this information. Your spouse, your parents, your friends. Please share this video and help protect someone else's memory today. And if you want more science-backed advice in simple, everyday language, subscribe to this channel and check out the next video we've linked below. Your brain matters. Your future matters. And it's never too late to protect both. Take care, and we'll see you in the next video. And don't forget to check the description below. I've listed some trusted health products that I personally stand by. These are carefully selected to support your blood sugar and overall wellness. Thank you for watching our video today. If you found this video helpful, please drop a like and subscribe button to support us. We truly appreciate you support, and it will motivate us to continue make more information video to help you all. Thank you, and goodbye.